Hi, my name is Melissa Smith and I'm doing my health assessment final. This is my partner Chantel. I will be assessing her today. You could, good morning Chantel.
Good morning.
If you could just hop down here, I'm going to check your vision first.
Sure.
Okay, we're going to do the Snellen test. Could you tell me which line you could read?
Bottom line. PEZOLCFTD.
Okay, and could you cover your left eye and read that for me? Read this line.
FDPLTCEO.
And could you cover your right eye for me and read this line?
LEFODPCT.
Okay, and you have 20/20 vision. Could you tell me what color this line is?
Green.
And what color is this line?
Red.
And does one of them appear to be longer to you?
The green one.
Okay, so your depth perception is intact. If you just want to sit up here for me, I'm going to check your blood pressure. Okay. I'm just going to start over here. Now I'm going to check your blood pressure. Could you tell me what you normally run?
Usually 120 over 80.
Okay. If this is my first assessment for you, I would check your blood pressure bilaterally. But for the sake of the video, I'm only going to do one arm. Okay. Now pump the blood pressure cup up until I can't feel the radial pulse anymore. I'm just going to Okay. Or 118 over 68. Okay, so next I would assess your skin. Your skin is a whitish pink color. It's warm, it's dry, you're intact. I don't see any lesions or any moles present. The turgor is good, it moves freely. No moles. Do you have any dryness or itching?
No, I don't.
Okay, the turgor is instant, good recoil, smooth texture. Next I would stop. Okay, next I would check your hair and your scalp. Your hair is blonde, it's shiny. Your scalp is intact, your hair is evenly distributed. Was there any tenderness when I was palpating your scalp?
No tenderness.
No tenderness? Okay. Next, I'll look at your face, your skull. Your nose is midline. Your eyes are symmetrical. Could you smile for me? Your nasolabial folds are symmetrical. Could you smile again? Your palpebral fissures are symmetrical. Your face overall is symmetrical. Could you clench your teeth for me? Okay, and could you protrude your jaw for me? Oh, there's a little bit of clicking there with the TMJ joint. That's normal. Your masseter muscle is +5 in strength. Now I'm going to assess your central nervous system. Could you clench your eyes tight for me? Okay, and could you wrinkle your forehead? And could you puff your cheeks out? Could you stick your tongue out? Okay. So that's cranial nerves 7 and 12. So you can raise your eyebrows, your facial features are symmetrical. I'm going to inspect your corneas next. I'm going to look at them from the side. Okay, and they are clear. And I would check everything bilaterally. The irises are blue. Could you just go like this and pull your eye down for me? The conjunctiva is pink and moist. Let's see. Next, I would check your pupils. They are both round. Let's see. We'll check their reaction to light. Okay, they both react equally. Let's see. Could you follow my finger? Okay. Your pupils are equal and round. They react to light directly and consensually, and they both accommodate as well. Now I'm going to test your visual fields. Can you cover one eye for me? Okay, and can you tell me when you see my fingers wiggling?
See them?
Can you see them now?
Yes.
Okay. So your visual fields, your peripheral vision is intact. Now I'm going to test for extraocular eye movement. Could you follow my finger? This is called parallel tracking. And your parallel tracking is intact. If we were in the office, I would put on gloves and I would palpate your lacrimal ducts for fluid regurgitation and tenderness, but we won't do that today. Okay, next I'm going to inspect the ears. Is there any tenderness?
No.
Okay. I'm going to palpate your mastoid. Is there any tenderness there?
No.
Okay. Next I'm going to inspect in your ears. Okay. I would pull the ear up and back and I would look in the ear. The ear canal is pink. There's fine villous hair present. I can see a pearly gray membrane, and there are bony landmarks present as well as the fine villous hairs. Okay. Let's see. Now I'm going to whisper something into your ear. Could you cover, thank you. I'm going to whisper 3 words to you. Could you repeat them back for me?
Sure. Dog, cat, ball.
Okay, great. It's the whisper test. Now I'm going to perform the Weber test. I'm going to take this tuning fork and I'm going to put it above your head. Let me know if you can hear greater in the left, the right, or equally, okay?
Sure. Equally.
Okay. Okay. So that's cranial nerve 8. Now I'm going to perform the Rin test. I'm going to strike the tuning fork again. I'm going to hold it behind your ear. Tell me when you can't hear it, and then I'll move it to the front of your ear, and then tell me when you can't hear it, and that will test your ear-to-bone conduction.
Can't hear it.
Okay.
Can't hear it.
Okay, so your ear-to-bone conduction is 2 to 1, and that's a normal finding. Okay, let's see here. All right, next I'm going to inspect your nose. Your nose is midline. Do you have any tenderness?
No.
No? Okay. I'm going to palpate your frontal sinuses. Any tenderness there?
No.
Okay. And then I'm going to palpate your maxillary sinuses. Any tenderness there?
No.
Okay. Let's see. I'm going to look in your nose now. You can see the lower turbinates. The mucosa is pink. And there are fine villous hairs in there as well. There's no discharge. Let's see. Alright, next I'm going to take a look at your mouth. Your lips are symmetrical, they're intact, they're pink. Could you smile for me? Your gums are well adhered to your teeth are white. No dental cavities, looks like your teeth are in good repair. Could you open your mouth for me? Okay, the inside of your mouth. Could you open your mouth? Let's see, your hard palate is intact. It's pinkish white with transverse rugae. Can you look under your tongue? Your soft palate is moist and glistening. Could you stick out your tongue for me? Okay, there's no lesions. Move it from side to side. Okay, thank you. Okay, the tongue is midline, there were no lesions. Let's see. That was also cranial nerve 12. I would, after inspecting your soft palate, I would put gloves on and use a 2x2 of gauze and palpate for any abnormalities there, but We're not going to do that today. I'm just going to take a look actually at your tonsils. Can you stick your tongue out for me and say, ah? Okay, your tonsils. You do have your tonsils, and your uvula is midline. Everything looks good in there. Next, I'm going to inspect your neck, and I'm going to palpate your lymph nodes. Your musculature looks symmetrical. Sorry, my hands are cold. Could you swallow for me? Okay, your trachea is midline. I'm going to feel for your preauricular nodes, which would be in front of your ears. Your postauricular nodes, which are behind. Then I would feel for your tonsillar nodes. Sorry, it tickles. Then I would feel for your submandibular nodes and your submental nodes. Did you feel any tenderness there at all?
No tenderness.
Okay, and they were non-palpable, which is normal. Then I would feel for your anterior superficial cervical nodes, which are here. Could you turn your head to the side there? Okay. Any tenderness?
No.
Okay. And I would feel for your supraclavicular and your infraclavicular as well with your head in that position. Any tenderness?
No.
Okay. Your trachea is midline. Could you swallow again for me? Sorry. Okay, there's no tracheal deviation. I'm going to inspect and palpate your thyroid. For this, I'm going to stand behind you. Could you turn your head to one side for me? Or like tilt your... There you go. Okay. And could you do the same on the other side? Okay, and then you can put your head back to midline. And then could you swallow? And could you swallow again? Okay. The thyroid moves freely. There's no nodules. There's nothing abnormal in the border of the thyroid. Now I'm going to do your head and neck strength. Could you tilt your head forward for me? And then could you tilt your head back? Okay, so you have flexion extension. Could you do side to side like this? Okay, you have rotation. Perfect. That would be lateral bending. Could you push against my hand? And could you push against this hand? Okay. So your next strength is +5. Now I'm going to palpate your carotid pulse. And now I'm going to palpate your temporal pulse. And again, I would be doing this bilaterally, but not at the same time. Okay, now I'm going to auscultate the arteries for bruits. So first I will use the bell of my stethoscope, and I'm going to do the carotid first. Okay, and the temporal. And there are no bruits present. They're both strong, +2. Okay, next I'm going to do respiratory. I'm going to inspect the movement. Could you just take a deep breath for me? Okay, and I'm going to check from behind as well. Okay. Could you take a deep breath for me? Okay, the movement is symmetrical. The muscle development is symmetrical. Your respiratory excursion, you have good thoracic expansion. I'm going to check your AP diameter. To do that, I would measure from the xiphoid to the vertebrae. And then I'm going to check you for tactile fremitus now. So every time I touch, could you say 99?
Yeah. 99, 99, 99, 99, 99, 99, 99, 99.
Okay, and I could feel the vibration equally bilaterally, and then it diminished equally as I got to the bases of the lungs. Next, I'm going to percuss. Could you give yourself like a big bear hug? Okay. And I'm going to percuss until I hear resonance. Okay, and there was resonance throughout. Next, I'm going to have you take a deep breath in and then exhale, and I'm going to measure your diaphragmatic excursion. So could you take a deep breath in? Okay. And exhale, and then I would mark this with a piece of tape, and then could I have you take another deep breath in, and then hold it, and then I would mark this with a piece of tape as well, and it's measures about 5 centimeters, which is normal. Okay, now I'm going to auscultate the lungs for any adventitious sounds. Could you take a deep breath for me? And again. And again. Okay. Your lung sounds were clear. There were no adventitious sounds. Okay, now I'm just going to check for CVA tenderness. I'm just going to percuss right here. Tell me if you have any tenderness, okay?
No. No.
Okay.